If you come in, you really are saving lives. There are very few of us that when we get up in the morning know that we can make a difference in somebody else's life or that we can save a life. And coming in here to donate means that you get to save somebody's life, and that's huge.
And we can prevent your grandmother or your mother or from being in the hospital and having to be on a respirator and being life-threateningly ill. This is a way to do that.
What we've learned is those individuals that have had COVID develop antibodies against the virus. Those antibodies are circulating in their plasma. We can collect those antibodies, and what then happens is if we transfuse it to somebody in the first 72 hours of COVID, we can actually prevent their symptoms from getting worse, prevent them from having to enter the hospital system, and reduce morbidity and mortality by up to 50% for patients that receive that plasma in the first 72 hours after the onset of symptoms.
Timing is everything. Some things work best when they're given later. Some things work best when they're given earlier. And convalescent plasma is one of those things that works very well if it's given soon enough, and not at all if someone's so sick that they're in ICU.
I think we all watched very closely after those first few units we transfused, and we had some great outcomes. And people that were able to leave the ICU and go home to their families, and that's great.
So I would like to say, oh yeah, it turns them around overnight. Anecdotally, I've seen that.
It reduces the burden on the healthcare system, meaning that anybody else that has a healthcare issue like a heart attack or stroke, that we have the healthcare resources to support them also.
This is a way for people to help. It is probably the best way anyone who's had COVID-19 can help, is if they're willing to at least get screened to see if they could be donors. It would make such a big difference to us here and potentially to anyone in the North Country if we can get everyone on board. And so it turns out that people who were hospitalized with COVID-19 in general make more antibody than people who were not hospitalized. And so I think our first priority as the North Country is to find everyone we can who was hospitalized over the past year and see if they would be willing to donate, because they're the people that are most likely to have enough antibody in their blood to make a difference for someone else.
To ensure that the patients that are receiving the convalescent plasma are getting the best benefit from that transfusion, we make sure that the level of antibodies in the plasma stays at a pretty significant level to ensure that we are getting the best possible outcome for the patients being transfused. But that does mean what we're finding is about 3 to 4 months after an infection, your antibody levels are dropping to a point where you're less likely to be eligible to donate anymore.
This is an effective therapy, and it's in our power to actually give it if we have enough donors. And so that's really what I want to say to folks is we would all be grateful if you're willing to keep donating and if you're willing to be screened to donate. You couldn't do anything more to help our own community than that right now if you've recovered from COVID-19.